Hello, hi, my name is Mohammed. I'm a nurse practitioner student at Herzing University, and today I'll be performing a neuro assessment on my brother Mehdi right here. He's 13 years old. Mohammed. Here we go. So first we're going to start off by testing the cranial nerves. And the first cranial nerve I'll be testing is the olfactory nerve, and I'm going to have him smell the object. Due to COVID-19, I was able to get certain supplies, so I'm going to be improvising. Here's some of the supplies I have, just a little heads up. But I'll communicate throughout the process. So first, cranial nerve number 1, I'm going to have you close your eyes. I want you to smell this. What is this?
Mint toothpaste.
Good. Moving on to cranial nerve number 2, I don't have the Snellen eye chart, so I'm gonna do the color test. So I have here 2 numbers with colors on it. I'm gonna have him first identify the first one. What is this?
24. 52.
Good. That was the optics. So now I'm gonna combine cranial nerves 3, 4, and 6, and I'm gonna test his eye movement. Follow my finger with only your eyes. Okay, do not move your head. Very good. So now we will move on to cranial nerve number 5, and I'm gonna have him close his eyes, and then I'm going to touch him, and he'll let me know if it's different or the same. I'm gonna be touching him with this right here. Close your eyes. Right now I'm touching you on the right. Is it any different here or the same?
Same.
Different or the same?
Same.
Different or the same?
Same.
Different or the same?
Same.
It's kind of hard to adjust the camera, but I was touching his bottom extremities as well. Now I'm going to test cranial nerve number 7, and I'm going to test his facial features. So Mehdi, please close your eyes as if you're mad at somebody. Open your eyes, raise your eyebrows, puff out your cheeks. A nice big smile, show your teeth, and he shows symmetry. Next, I'm going to do cranial nerve number 8. I'm going to do the whisper test. So I will whisper 3 words to each of his ear, and we will see if he gets it correct. I wrote the 3 words on this paper. I don't know if you can see it. What were the 3 words?
Jordan, Kobe, Magic.
Jordan, Kobe, Magic. What were the 3 words?
Jordan, Kobe, Magic.
So he got it correct. It was Jordan, Kobe, and Magic. So I'm gonna do cranial nerve 9 and 10 together. I'm going to have I'll be looking at his uvula. So I'm gonna have you just say ah.
Ah.
And his uvula is midline. Next, I will do cranial nerve 11, the spinal accessories. So I'm gonna have his head move against my hand movement, and we'll test his resistance. Go to the opposite of me. Go this way. This way. Harder. Forward. Back. Good. Now I'm going to test cranial nerve number 12. And that's the glossopharyngeal and the hypoglyceal. So I'm gonna have him stick out his tongue, and I will check if it's midline. Say ah now, but stick out your tongue. And I see now that it is midline. Very good. So now we're gonna test cerebral function. I'm gonna test his upper and lower extremities for any movement, coordination, fine motor. So I'm gonna have you stick out your hands for me. This way, and then move him rapidly. Good. So he does have fine motor movement in the upper extremities. Now we'll test his lower extremities. I'm gonna have him lay down for me, Mehdi. I'm gonna do his heel. I'm gonna have him do his heel to shin. Move your heel to your shin. Good. Good. So he does have fine motor movement in his upper and lower extremities. You can sit back down. Now I'm going to perform the Romberg test. So I'm gonna have him stand up. I'm gonna have him close his eyes and count to 10, and I'm gonna put my hands out just in case. Okay?
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Open your eyes. So I noticed that he's not swaying. Now I'm gonna test his gait. I'm gonna have him walk around our basement. Because the camera's hard to move, I can't adjust the camera, walk around. But I will be monitoring him, and his gait is normal. You can walk back. We're gonna be moving on to sensory function. So I have a couple objects, and I will test his object discrimination. So here's my objects. Mandy, close your eyes. So I'm gonna start off with the object test. Here's the two objects that I'll be using. Mandy, close your eyes. Okay, open your right hand. What is this right here? Feel it out.
Small battery.
Good. Open your hand. What is this right here?
Pencil.
Good. So you got it right. It was a pencil and a battery. Very good, Mehdi. Now we're going to I'm gonna have a couple objects, and he's gonna let me know if it's sharp, dull, or soft, sharp, or dull. I'm sorry. So I'll be using this napkin right here. I have the end of the Q-tip and the part that I ripped out as my sharp. So Mandy, close your eyes. Put your leg out for me. Is this sharp, dull, or soft?
Soft.
How about now?
Soft. Soft.
I'm on is the lower extremities, by the way.
Soft.
I know the camera doesn't show it.
Soft. 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 Soft.
Keep your eyes closed. How about now?
Dull. 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 Dull.
I forgot to show the camera, but I'm on this part section. Keep your eyes closed for me, Mandy. Good.
Dull. 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 Dull.
Keep your eyes closed. Using this section now. What is this?
Sharp. 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 Sharp.
Good. You can open your eyes. So he was able to discriminate whether the object was sharp, dull, or soft. Very good. So I do not have a tuning fork. I had ordered one on Amazon. However, it didn't come in because of the COVID-19. It didn't come in after the assignment was due. So I'm going to improvise and use this fork right here. And what we would do is we would get it to vibrate, and then we would put it on the bony prominences to see if he feels the vibration. So that's what I'm gonna do right now. I'm gonna pretend like I'm striking it, and then we're going to see if he has vibratory responses. So right now I'm gonna act as if it's vibrating. I'll put it on the bony prominences right here, here, his knee, down to his ankle, right there, right there, right there, right there. Good. So now we're gonna do sensory perception. I'm gonna have him close his eyes, and he's gonna stick out his fingers, and then he's gonna let me know if I'm moving it up, down. So Mandy, close your eyes. Close your eyes. Stick out your hands for me. Am I moving this up, down? Am I moving this up or down?
Up.
Am I moving this up or down?
Down.
Okay, I'm gonna take off your socks for 1 second. Am I moving this up or down?
Down.
Up or down? Up or down? Good. So now we're gonna do 2-point discrimination, and then I'm gonna touch 2 parts of his body, and he's gonna identify which parts of his body I'm touching. Okay. So Mehdi, you're gonna close your eyes. I'm gonna touch 2 parts of your body. You're gonna let me know which part of your body I'm touching. Okay.
My bicep and my thigh.
Okay. Which side of your bicep is it? Your right or left?
Right.
And which part of your thigh, left or right?
Left.
Good. What parts am I touching?
My left bicep and my right thigh.
Okay.
My right forearm and my left leg.
How about now?
My right leg and my left thigh.
Good. Put your feet up.
My left foot
And what?
and my right forearm.
Good. How about now?
My left forearm and my right foot.
Good. So I know the camera wasn't able to kind of detect it, but he did get the assessment correct. When I was touching his foot, he responded with the correct foot, and vice versa for the other side. Now I'm gonna do the graphesthesia. Forgive me if I pronounce it wrong. I'm gonna draw a number on his hand, and he's gonna let me know what number it is. He's gonna have his eyes closed during this. I'll close your eyes. Stick out your palms for me. I'm gonna draw a number. Let me know what it is. What number was that?
7.
Good. No, this one. What number was it?
7.
Good. So he was able to properly identify what number I was drawing on each of his palms. So now we're gonna do body area discrimination. It's kind of similar to what I did earlier. I'm gonna be touching different body parts, and he's gonna let me know which area of the body part I'm touching. Close your eyes. What am I touching?
My pinky.
Good. What am I touching now?
My left thigh, my right leg.
What part? What am I touching now?
My ear, my right pinky.
Good. How about now?
My right cheek and my left elbow.
Good. So he was able to identify in his upper extremities what I was touching. Now I'm gonna focus more on his lower extremities. I know the camera doesn't reach it, but I'm gonna do my best. What areas am I touching?
My right knee and my left ankle. My right ankle and my left leg.
Good. So now I'm gonna move on to some superficial and deep tendon reflexes. This was another area I did not have the instrument to test the reflexes. I had to improvise due to COVID-19. My order got delayed, so I'm going to go ahead and act as if I will be testing it with this. I'm going to be testing his abdominal reflexes. I'll also be improvising. So Mehdi, I'm going to have you lay down on the couch, flat on your stomach. So what basically I'm going to do is I'm going to move my fingers along his stomach, and I'm going to test for lay on your back. I'm sorry. I'm gonna look for a quick movement, and if he has quick movement, that's a good sign. So move your shirt for 1 second. And I know the camera doesn't really tell, but by my observation, I will let you know what happens. Good. You can sit back down. So he did have quick movement, and he had some quick tightenings, so he passed that test. For the plantar reflex, I'll be stroking his foot, and I'm going to be looking forward to see if his toes are curling backward. Okay, so stick your feet out for me, so that the camera can see it. Sit all the way back. Okay. Good. Now this foot. Higher. Good. So he did have that reflex. So far he's been a 2+ for both exams. Now for the deep tendon reflexes, that's where I would be striking him pretty much with this, and then looking for the fast flinch and because I don't have the little hammer, I'm going to be using this, so I'll be testing different areas. So ready, sit down normal for me. So I would strike here on his bicep, look for the quick flinch. If it's normal, it's a 2+. The same thing on the tricep. The brachioradialis, this side, the tricep, the bicep, then the tricep, the brachioradialis. I'll test the knee with the tether. And then I could do the Achilles as well. I'm gonna have him pretty much just gonna sit like this for me. Won't sit like that for me. Right here. Switch. So he pretty much, with what I was improvising with, he did have normal reflexes, so I'll rate that a 2+, which is normal. Also now we could test ankle clonus. So we'll have him, I'm gonna have him pretty much flex his feet rapidly, and then I will look for to see if he was able to control it, and if he is, that is a normal response. So I'm going to, how to grab this camera. So ready, put your feet out normal for me. Now rapidly move your feet. Your feet and your ankles. Rapidly, fast. Now stop. So he was able, so good. So he was able to instantly stop. So he did have the 2+ ankle clonus. Now that concludes the assessment. Like I said, I'm a nurse practitioner student at Herzing University.